with confirmed COVID patients. We can see that again, since the mid of June, the numbers of hospitalizations have increased. And we shared that the increase is seen mostly in the 20 to 29 and the 30 to 39, as well as the 40 to 49 age group. Next slide. And this again is another rendition of hospitalizations by age group and week of hospital admission, again since May 25th, and particularly since mid-June. Again, the increase has been seen across all of those three age groups that I just shared with you, 20 to 29, 30 to 39, and 40 to 49 age group. Here they are grouped a little differently than the way we report them on the table that was shown at the beginning, but still the age range, particularly from 20 to 39 and 30 to 39 and from 40 to 59 are the highest age groups, with the aside of 60 plus, which is the highest, but we see the increase in younger age groups below that. Next slide. So now I would like to move into our triggers. So this slide has the consistent three triggers that have been abnormal for the past week to 10 days. And trigger number one is associated with case rate. This is the trigger that gets us on the state monitoring list. And if we will go to the next slide, it shows how we have progressed from July 9th up to the 15th. So again, this is what the state monitors available can be found on their website, where they compare all counties to each other. Next slide shows information about outbreaks. So this is trigger 2. And the target is 7 or more outbreaks in the past 7 days. And as you can see, in the past 3 weeks, we have continuously seen an increased number of outbreaks. And today, our target, the next slide, is we have 14 outbreaks in community settings. And in the past 7 days, we have a total of these 14 outbreaks. And this slide and the next slide shows the category and breakout of the various locations. And these are the 4 newest outbreaks reported and confirmed as of yesterday. We have one in a laboratory, one in a hair salon, one barbershop, and one in a restaurant/bar. The next slide, this shows or is related to trigger number 11, which is related to case investigations. And the target here is no less than 70% of all cases reported are contacted or contact is initiated. And we thought after that number was declining to 57%, we were on the upswing, but started to decline again because the numbers are continuing to increase. Today we issued a job announcement for staff to come on as case investigators, and after only 3 hours we had over 300 applications received. So we anticipate that bringing on onboarding and training these staff that are hired will improve this particular trigger. Next slide. And lastly, we want to encourage everyone to practice good hand hygiene and sanitation, to keep their distance 6 feet apart, wear face coverings, and avoid crowded places, and to also stay at home if you're sick. That's a very important factor, and we want everyone to adhere to that. Adhering to these strategies will help to decrease the spread of COVID-19. So now I would please welcome to the podium, I'd like to introduce Dr. Scott Eisman, who will talk to us about hospitalization of our younger population with COVID-19. Dr. Scott Eisman has been practicing medicine in San Diego since 1990 and is board certified in internal medicine since 1985, board certified in pulmonary medicine in 1980, and board certified in critical care medicine in 1989. So he is a definite expert from Scripps Healthcare to talk about this issue. Dr. Eisman. Thank you.
Good afternoon, and thank you for asking me to come and talk today. As we've heard from Dr. Wooten, the incidence of this problem is increasing dramatically, and the ages of people that it affects are now changing as well. We've clearly seen that in our own practices, that we have young and younger patients showing up with more and more significant complications, and it's certainly true that the mortality rate for those that are younger is lower than those that are older. But it's also true that the mortality rate is not zero. And it's also that this disease is impactful not only because of the possibility, that's bad enough as it is, but I think what is really fundamental is to understand the differences in this illness compared to what we think of as a flu. I know many younger people think that this is something that you'll get and you'll overcome and everything will be fine. But the complications of this illness are far greater, they're much longer lasting, and they're far more serious. And so I think it's very important for the public to hear how these things are different. We know that COVID-19 affects the lungs differently than just the flu. Not only does it affect the little air sacs in your lungs that we call, but it affects the blood vessels in lungs as well. It causes blood in general, not just in the lungs, and that can create very substantial problems with the ability of the lung to deliver oxygen. It's much, much more profound, much more rapid than we typically see in influenza. And let's remember that at least we have therapies and an effective vaccine for influenza. We do not have that as much for COVID-19. We know that smoking increases the chances that if you do contract COVID-19 and if you develop pulmonary complications, that those complications may be more severe. There's good evidence that that is also true for vaping, not to mention the fact that we would have a hard time distinguishing what type of lung problem you have, because vaping can cause its own lung disease as well. And we've seen a number of cases of that as well. Besides pulmonary disorders, in breathing disorders, I think one of the really important things to understand about this illness is that it's not just limited to the lung. It causes neurologic disorder. We now know stroke is described in young patients as well as older with COVID-19, difficulty in thinking, weakness. We know that there are effects on cardiac function in terms of heart failure and irregular heart beating. We know that there are complications with the kidneys, blood system, liver, and those complications may be much longer lasting than people recognize. We don't really know at this point exactly how this will play out because the disease is too new. We do know, though, I can tell you of a patient that I saw about 6 weeks ago, who was a young man who came to the hospital, 40 years old. His wife and his brother-in-law were both infected as well. They all lived together. And he spent 45 days in the hospital. He was on high-flow oxygen and laying on his stomach to help improve the delivery of oxygen into his bloodstream. So for a month and a half on his stomach. And I think if you're a 30 or 40-year-old individual, you have to think of what that would be like to your life and how long it would take to recover from that. Being weak, not eating well. We know, for example, from the experience in China during the SARS virus, the initial SARS virus in 2003, that studies showed that it's had a significant decrease in their lung function for up to a year after that and longer, particularly those patients who had severe pneumonia. So we think that likely this disease will be at least as bad at that, if not worse. The same was true of the MERS viral illness, all of which are coronaviruses. This virus seems to be much, much more aggressive than those two viruses. And we know from clinical experience that recovery can be very protracted. People take a long time to return to work, to get their strength to, even to think properly, because it does affect your ability to think and reason and remember. I don't think I can really overstress the importance of trying to prevent the illness. I think if people feel that this is something they can contract and it's not going to be a problem and not going to be a serious thing, then they're not as motivated to do the thing to prevent illness, such as distancing and hand hygiene and wearing masks and avoiding crowds, avoiding crowded places such as restaurants that are very tightly packed. I know in Encinitas, 2 months ago, a month and a half ago, I was driving down 101 and it was very packed. And now we see, not but a month or so, 5 weeks later, a spike in the frequency of the illness. I think if people will take those precautions to heart, hopefully it will avoid having a very serious illness for people. And although I know it's tough to avoid being out among everybody, it's much tougher to contract the illness potentially, and potentially fatal. Dr. Wu? Chairman Cox?
Thank you, Dr. Eisman. And again, we want to thank all of the doctors and nurses, all the first responders that have played such a key role in dealing with this whole pandemic. They certainly have gone above and beyond the call of duty, and we can never thank them enough for their service and their commitment and the long, long hours that they are putting in. With that, we're going to go directly to the questions. So let's hear the first question.
Melissa Messiha from 10 News, please state your question.
Hi there. I just had a question just regarding nursing homes. I know the state task force has been brought into One Paradise Hills nursing homes. Are you aware of how many nursing homes or other facilities locally that has had to have the state task force help?
We'll ask Dr. Wooten. Oh, actually, I guess we're going to ask the director of our Medical Operations Center, Rob Sills, to respond to that.
Thank you, Supervisor Cox. I believe the question was how many skilled nursing facilities the state has come down to assist with staffing, and the answer to that, 3. We've reached out to the state for staffing assistance, and they have come to, there are, all of our skilled nursing facilities are getting assistance with PP requests from the state, but as far as staffing, I think that was your question. The answer is 3.
Yeah, it was regarding the state task force. I think they were helping with testing, so it's 3 nursing homes?
It was, the question I heard was staffing, so that, as far as the state task force on testing, none of them have gone into the nursing home. We are giving them testing kits, and the majority of them are doing it themselves, and we're running those for them in conjunction with all the testing that's going on with the county. So I believe that's your question. Thank you.
Okay, we'll go to the next question.
Bridget Naso from NBC7, please state your question.
Thank you. My question is about the number of tests. On Monday, you talked about a shortage of tests, although getting some help from a San Diego-based company, and we know Rite Aid is helping now with some free testing. But how long do you anticipate that shortage? What are you doing to address that shortage, and possibly on the cause of the shortage of tests, how that's impacting the ability to determine just how many people, here we are a week after 4th of July, may be coming down with symptoms of COVID?
Okay, I think perhaps both Dr. Wooten and Nick Mascione are going to respond to that question.
Thank you for the opportunity to clarify information about testing. On Monday, we shared our strategy, and we are partnering with Helix, the specimen collection and actually even running the test so that it will leave our public health laboratory available to focus and prioritize outbreaks. So we've developed that partnership, and the shortage of supplies is not just a San Diego issue. This is a nationwide issue, and we feel that we have addressed it, and we've even reprioritized our priority list, and it is in much alignment with the state's priority list that came out yesterday. And while we overall be testing less number, we still feel that we're able to continue to test to meet the targeted goals that we've identified.
Yeah, just to add to Dr. Wooten's statement, we really don't know. And it's upon the manufacturers of these reagents that have to provide it. We do know there's a tripling down of these various companies throughout the country, as Dr. Wooten said, to meet the need nationwide, particularly with high prevalence states like ours that need more of these reagents. But I do want to also mention that it's not just the testing kits. It is the testing machine. It's also the lab staff. So we are ramping up, our lab staff, and many of our hospital partners and even community clinics are doing 3 shifts, 7 days a week to try to meet the demand, but also testing equipment. And there's a backlog on testing equipment. So we have to balance all 3 of these factors, but rest assured that the county lab, our hospital partners, our lab testing task force is working together with our commercial labs and now our new partner with Helix to meet the needs of our county region.
Okay, we'll go to the next one.
John Carroll from KPBS, please state your question.
Yes, thank you, Supervisor, for taking our questions. You are no doubt aware of the situation to our north in Los Angeles County. If it's not dire, it's pretty close. Mayor Garcetti has now said that he is considering locking down the city, enforcing stay-at-home orders. Does that give you a level of concern for us down here, since we're just a short drive away? And what addition to it, and what, if anything, are we doing about that? And I have a follow-up.
Okay, I'm going to ask Dr. Wooten if she'd like to respond to that question.
Sure, we have several people that may want to respond to the question, but hearing that information, we are driven by the data, and Los Angeles is that's the city of Los Angeles, but the entire county is 3 times the county of San Diego. So obviously the burden that they experience is far greater than what we have experienced here in San Diego. We will continue to enforce the guidance that have been issued statewide, and if we need to do something in terms of closing quote-unquote borders from other jurisdictions, that's a political decision that will be made locally. Dr. McDonald?
No, if I could just add one thing to what Dr. Wooten had to say. I listened to Dr. Eisman earlier talking about the impact that this disease has on those who are increasingly becoming affected in our community. I think that answers the question that you were really asking. Here in San Diego, our rate of illness is fortunately lower than actually any other county in Southern California. Imperial, Orange, Riverside, LA, and San Bernardino all have higher rates than we do and are being affected disproportionately compared to us. Even within the county, we have areas that are more affected than others. And the message that everyone should take home is exactly the cost that Dr. Eisman gave about what you can do to prevent the transmission of this disease within the community. So going out only when it's necessary, wearing masks, washing hands, and socially distancing. I mean, it's a simple message, but it needs to be repeated over and over. We need to refocus our own daily commitment to that when we hear these stories about our neighbors and friends north and south of us who are being affected disproportionately by this disease.
Thank you, Doctor. And then just a quick question, a reaction to the lawsuit filed by several local gym owners that insist on staying open right now.
Well, I don't think we've had a chance really to see those legal proceedings at this point. I'm sure we'll get a chance to over the days, and we'll try to prepare an appropriate response. Okay?
Thank you.
Next question.
Brandon Lewis from News 8, please state your question.
Thank you. I wanted to ask about the recent state-imposed closures that went into effect today under the health officer's order. And I'm wondering if the decision to reopen is going to be based upon the rate per 100,000 that is trigger number one, or is there still a chance that some businesses could reopen on July 27th?
I'm going to ask Dr. Wooten to respond.
Thank you for that question. The restrictions that have been imposed on San Diego are from the state, and that metric, the trigger number one, is the metric that has placed us on the state's county monitor list. So until further notice, as has been stated by the governor on Monday's press briefing, until further notice, there will be no additional openings. And because there were additional closures made on Monday, even the 3-week assessment period is now, it's not 3 weeks now. It's just basically the assessment will be made and the state will determine when businesses will reopen. So we will await any decisions and guidance from the state. Thank you.
Okay, next question.
Matt Hoffman from KPBS, please state your question.
Hi, I'm following up on an earlier question regarding testing processing. I've talked to some people who've gotten county tests, had to wait for about a week. One gentleman is still waiting for results after 3 weeks. I know Dr. McDonald had said that, frankly, we have an issue with turnaround time. Are you saying today that that's because we don't have enough staff or the right lab to keep up with demand? And how do you guys correct that with the, as you just mentioned, a shortage in supplies?
Okay, I'm going to ask Nick Mastione, the Director of our Health and Human Services Agency, and the T3 czar to respond to that.
Matt, thanks for the question. Just to clarify, testing is done at many levels in our region. We try to do it seamless for folks to sign us, but we have county testing sites, we have state testing sites, our hospitals doing sites, CVS pharmacies are doing sites, and depending where you go, it's done by different labs. And indeed, it was more recently even shared by that they're very backlogged. They're about 7-10 days out in their results. We acceptable. They're trying to do better to that. Not too long ago, weeks ago, we had lab equipment went down and we got behind. Presently, for those sites that are coming to the drop-in site, for example, at Tubman Chavez, from the time that test is taken and goes to our lab, it's about 3 days by which is provided and which our EPI team is made aware and quickly gets to those positive cases. We're striving even to be better than 3 days. Hospital partners, when you get tested at the hospital, because the urgency of hospitalization, are doing it within 24 hours or less. And even our public health lab, when we get samples from outbreaks, highest priority, or a skilled nursing facility, those are conducted in 24 hours. So we are, to your point, results that are not coming in timely, and some of this is from our commercial labs. Indeed, it's attributed to lack of reagents and capacity, and what I just talked about earlier, equipment, people, and supplies, and everyone is trying to improve that. But again, the urgency by which the turnaround from the public health lab and our hospitals are performing very well. Thank you.
Gotcha. And so you guys basically believe with this new sort of focus strategy, partnering with Helix, that even though you guys might be doing a little bit less testing, that you're still testing sort of the right people, the right population to still get a scope of where the virus is?
Yeah, just one thing, we're prioritizing the groups because those are the people that need to be tested. and we're seeing more cases, as that was shared by Dr. Wooten. So we're going to have more people to be tested that need to be tested. So the county testing with Helix now getting up to 2,000 a day is actually going to allow us to possibly do the same and if not more testing. As mentioned, those are more tests. So preserving that with Helix absolutely is going to be critical for the county health lab. But again, to put in perspective, that represents maybe 30-35% lab. The rest of it, the lion's share of it, is our hospital partners that are doing testing, and then of course the commercial labs.
Thank you for that explanation.
Okay, let's go to the next question.
Bill Center from the San Diego Union Tribune, please state your question.
I have several. The first one is the Del Mar Thoroughbred Club, with assistance from the county, tested jockeys and jockey room personnel on Tuesday, and they came back with 15 positive tests. First question is that considered a cluster? And the second part of the first question is the county pleased with the steps and protocols being taken by the Del Mar Thoroughbred Club? And also, do they think that they will be able to resume racing on July 24th, as is the plan?
Okay, Dr. McDonald's going to respond.
Yes, thank you for that question. Indeed, if you're familiar with the history, that there were a pair of jockeys that were identified the previous weekend who had previously been in Orange County, along with 3 other that were in Orange County but then went to other venues. They were subsequently diagnosed with COVID. More than 3 individuals from different households in a specific location meets the definition of an outbreak. And so in follow-up to the cases that were here in San Diego, we did some close contact investigations and some testing, as was really described previously, what our normal process is. And that occurred yesterday, and the results came back today, which resulted in these the identification of those individuals, all of whom are asymptomatic, which is good news. But because they've been identified, they all are now in isolation for 10 days. And as far as the impact of that on future racing, that's a question that's best for the Thoroughbred Club. I'm a medical person, not a horse person, even though I grew up in Maryland, as you can tell from this. But we're continuing to look at those individuals and their close contacts that may indeed drive more testing and may uncover some more cases. This is an ongoing outbreak that involves ourselves, the Orange County Health Department, the California Department of Public Health, and some other state organizations to get a handle on exactly how many cases there are to get that under control. And does that answer your questions, or is there? I'm sorry.
No, that answers my question perfectly.
Okay, thank you.
Thank you.
I might just point out on that last question that because this was a part of a cluster, because it was individuals that were symptomatic, we were able to get those test results back in 24 hours. And so I think that's an indication that the time lag that we have witnessed or had to deal with earlier in this pandemic is changing dramatically as we get like Helix on board and other testing operations coming into effect. Let's go to the next question.
Chris Howard from KUSI, please state your question.
Hi there. I know we've talked and touched on the testing machines and lab staff, but I'm wondering if we can figure out about the components of the tests that are depleted. Do we know if it's swab, serum, maybe both? And then what's going to happen to the 3 Ts now that we are experiencing this shortage? I'm wondering if this is going to skew our positivity rate with limited testing that could potentially be happening.
Okay, I think this is going to be a 2-part answer. We have Dr. McDonald, and then we have Nick Mascione.
Yeah, Thanks for that question. I think actually Nick gave a great answer to that. We'd like to talk about the 3 S's, the staff, structure, and supplies. The structure is the actual machines that are used, and there's a number of them, and they can only be run a certain amount of time during the day. There's staff that are required to actually run those machines, and in various laboratories, there are a lot of microbiologists working overtime, not just working with the machines, but preparing the samples in order to be put on those machines. And I can tell you that in our public health lab, we've brought on a lot of personnel, as have the hospital labs, and those people are working overtime. So that's very important. And those individuals are just like our healthcare workers, tirelessly doing their part to contribute to information about this outbreak, and it is stressful for them, and I want to thank each and every one of them. And then the supply issue, different supply issues starting from the swabs themselves, depending on which swab you have to use on which machine, to the transport media, to actually the little dippers that are used for sample by sample on a machine that then dip in and then draw up the aliquot so that the machine can analyze it. It turns out that that is a specific piece of the machine that is in short supply for some machines. And so you have to have every single component lined up. And most of the time this is seamless. It's only when you're in a situation like this where you have literally millions of tests being done across the country and tens of thousands of tests per week here in San Diego, that those small, seemingly insignificant components become critical, and they are specialized. And so it's all of the above.
And then if somebody could speak to the 3 T's.
Yeah, I'm the 3T. Thank you, Dr. McDonald. And you're going to get a 3 for Dr. Wooten. We'll talk about the positivity rate that you asked. So for the 3 T's, right, this is the test, trace, and treat. We're not wavering at all from our testing. I think we're emphasizing again, ever since we stood up the T3 strategy, it was testing for the right people, the high priority. That is not wavering. We'll continue. And the importance of that is the purpose of the test is to find people who indeed are positive so that we can immediately do our epi investigation and tracing and do it with speed and accuracy so we can have people to self-isolate and to disrupt the spread of the virus. The treat part is there. The county is standing proud of helping anyone who needs a place to self-isolate. I think you saw the last statistic that was provided, T3 chart. We varies day to day, 70 people that we'll have in our public health rooms, providing them the support so they can safely isolate, return back to then their place of residence. So that T3 strategy is integrated, as noted, and it's vital to our strategy here in the region. Turn to Dr. Wooten and talk about the positivity rate.
Thank you.
I've asked staff to bring up 2 slides. The first is our triggers dashboard. Positivity rate is actually one of our triggers. It is number 10, trigger number 10, and we want that to be less than 8%. So you trigger number 10. We're green there. The actual target, we want that to be less than 8%. If we go to the next slide that you showed first, while we are maintaining that, and that less than 8% over a 14-day period, a rolling 14-day period, we are at 6.3%. And then overall, each day, we measure the total number of positives over the total number of tests reported. And these are not duplicates. These are uniquely individual first-time positives. They're not duplicated test results. So we aren't, as some people and rumors are out there that we might be missing our total. So these are all confirmed cases based on the definitions that I shared with you on Monday. Does that answer your question?
And Dr. Wooten, yes, just to follow up there, when it comes to, though, the amount of tests we're getting right now, if we're fearing that the number of tests that we administer will be decreasing because of all of the reasons that Dr. McDonald explained, do we see this affecting the positivity rate in the future with those limit the number of tests? And then I have one more question after that.
Unless there is a greater burden on the supplies, but based on what we know right now, while our over testing might decrease somewhat, we'll still be able to maintain those targets or goals that have already been set by the state. Again, in stage 2, 1.5 tests per 1,000, and in stage 3, 2 tests per 1,000, and 1,000 is 6,600 tests. So we are confident that we can at least maintain that. But things may change in the future, so we could have a different answer for you in a month or 2 months, depending on what things look like at that time. Thank you.
Thank you. And Dr. Wooten, final question. You could just step us through the evidence for those business owners that are having to shut down today, the bars, the restaurants. What evidence is guiding the decision to say that a person is more likely to get COVID or spread COVID in a restaurant or a gym versus maybe somewhere like at home where it's being passed to family members? If you could just step through that.
Well, all of the settings that you've just named, we have outbreaks where those cases have been identified. Outbreaks are when we have a large number, actually 3 people from different households associated with a particular location. But we know that there are people all over the county associated with numerous types of settings. It might be 1 or 2 people that are positive. So the point of the matter, the cases that we report every day, today we had 559 cases. The outbreaks that we've been sharing with you over the past, throughout the pandemic, that's the evidence, the increased hospitalizations. I didn't cover deaths overall today, but increased deaths. All of the information that we are sharing with you is the evidence of the need to dimmer back so that we can put things in perspective, so we can again try to reopen again so that people can get back to their normal lives. But as was stated before and in the light of my presentation, if people adhere to those strategies, we can get back faster. And there's the slide there. Thank you.
Thank you, Dr. Wooten.
Okay, we have our last call-in question.
Paul Sisson from the San Diego Union Tribune, please state your question.
Thanks for taking my call. Can we get an update on the Helix collaboration? How many test results have been returned to date?
Okay, Nick Mascione is going to come up and respond.
Paul, thanks for that question. I think today was about a little under than about 1,000 we've collected thus far. Just wanted to point out with Helix, it is 2,000 a day. We're ramping up to that 2,000 a day. So it's not just immediate. They have the supplies. We have they gave us about 7,500 samples. 10,000 also have been ordered, receiving within the day. And so I'll have better numbers and a little bit further down, and happy to provide those.
Thank you. I had a question about contact tracing, which we saw in today's report hit what looks like a new low at 46% of new cases investigated within the 24-hour standard. We know that you guys would like that to be at least 70% of cases investigated within 24 hours. This result comes after several days of this percentage. It looked like you were going to get back to 70 soon. Now it's suddenly gone in the opposite direction. What is causing that reversal of trend there?
Yeah, I'll take part of it and then also give it to Dr. Wooten. So the goal, obviously, is to be well into the 90s. I think the threshold is 70% for the state, well into these for us. When you look at the response beyond the 24th hour, so if it's the 25th hour, it doesn't meet that goal. So when we're looking at within 48 hours, the 80% percentile range, obviously we got to get into that 24 hours. So what Dr. Wooten was talking about of the onboarding of staffing, we're also upgrading some of the contactors that have the skill sets to be cross-trained to do that disease investigation. So there's tremendous amount of work. It is, though, because of the spike in cases. And so, again, as the spike has come in, we're trying to ramp up to that effort of disease investigators but I'll turn to Dr. Wooten to add some more.
Nick answered the question there. Because of the increased numbers of cases, we had 559 new cases today. We're really above 100 pretty much for most days. So it's a number of cases, Paul. It's simple. There's no other answer. And it is just difficult for staff to keep up. So we are bringing on more staff. And as you may or may not have heard earlier, we put out a job announcement today for case investigators and got 300 applications after 3 hours of that announcement being public. So we are bringing on more staff. Since our numbers to tank, we did adjust, do those things that Nick Machione stated, and we share with you our mitigation plan. But again, numbers are not declining. They are continuing to increase. So that's what is contributing to that particular metric.
Thank you, Dr. Wooten.
Oh, you're welcome,
And I
Paul.
noticed that there was a local lab in the list of community outbreaks today. Can you tell us any more about that? Was that a COVID testing lab or some other sort of lab? We have a lot of different types of labs
Do you want-
here in San Diego.
Dr. McDonald will speak to that.
Sure. It is one of the local labs here in San Diego. I actually do know that that lab does do some COVID testing, but like many venues, we don't think it is the workplace that's the issue. It's actually workers who are at that workplace and are interacting with each other outside the actual bench areas. This is a thing that we've seen in some of our healthcare workers in the past. It's more likely expose each other when they're not in the actual specific work environment. It's actually when they're in a break area or they socialize together, that sort of thing. So I hope that answers that question. And also just wanted to say that, again, we our metric on tracing is always to get within 24 hours, but the good news is that within 48 hours, we're doing much, much better, 75, 80% success in reaching individuals. I'll be honest, we've set some pretty tough standards on ourselves to be able to get these contacts as quickly as possible. I think if you look at and compare us to other health departments, I think we do very well. There are some health departments that aren't able to contact trace at all, and it's really unfortunate. So I really am grateful for the staffing support that the city has given our team to be able to expand it to the nearly 500 people that are on our roster at this time, and it's going to be expanded further because we do recognize that this is important, and we do want to meet our own self-imposed tough metric.
Thank you, Paul.
Paul, I wanted to make one additional comment in terms of the metric for case investigations. What we want to see is 90% or higher for case investigation and contact. The triggers are metrics have been developed so that if there are issues that are going on that we need to that would help support our taking action for changing our health officer's order. So they're similar categories or criteria, but different metrics based on the action that we want to take. Does that make sense?
Thank you, Dr. Wooten.
All right, thank you. Yes.
And Dr. Wooten, the first text question is from Misha De Bono with Fox 5. For gyms and other businesses, if they decide to defy the orders from the governor and stay open, what are the repercussions?
So just in general, we want to maintain compliance with the governor's order. And if there is non-compliance, then that will be referred to law enforcement and our compliance team to investigate.
Okay, this next question is from Cassie Carlisle with Channel 10. Some businesses have taken up lawyers who say the health department filed the orders to shut down businesses. If they have no health violations and are following the current guidelines, they say they should be able to remain open. How can they be asked to close if they are in compliance?
And we are following the state's guidance. And while individuals might feel that they are following the guidance and have no issues, it is about the community. So in order to decrease the number of cases, the governor has set out these restrictions, and we will continue to comply with that.
Okay, this next question is from Heather with Univision San Diego in regards to outdoor malls. Indoor malls have to close, but what about the outdoor malls like Fashion Valley, UTC, and Las Americas?
Yes, thank you again for the opportunity to clarify that. On Monday, we talked about how with indoor malls, if a business is inside, they can continue business by having curbside operations. For businesses that open up to the outside, they can continue, as far as we understand, and the interpretation of our county council, that those businesses can continue to operate. But again, operating by maintaining the strategies that are recommended: social distancing, wearing of face coverings, and hand hygiene and sanitation.
And this next question is from Carlos Gonzalez with Univision. Just to clarify, inspectors are tasked with, what are they tasked with now that restaurants, gyms, and lawns are closed, and how many inspectors are there?
Well, in terms of numbers, what we have a compliance program that is being developed, as I shared with everyone on Monday. And so right now, the lead for that program is formalizing the process, the protocols. We're in the process of doing that. But while we're doing that, we're also working in collaboration with the state's strike teams that are going out to various businesses. And we understand that that will not be in operation for probably for another couple of weeks, but we will still be working in collaboration with the state, and then expand and develop our own local compliance program. So I can't tell you how many. It is comprised of staff from various departments.
That's it, Dr.
All right,
Thank you
thank
very
you.
much.
This next question deals with testing. We're going to ask Nick Mastriano to respond.
Okay, and that question is, we see the number of tests fluctuate from day to day according to the charts you keep showing. Do the numbers change in accordance to test capacity or number of people who get tested? And this is Nelly Cervantes with El Imparcial.
Yeah, great question. So you'll see peaks and valleys if you even go back the chart we had, but some consistency in the last 3 weeks, getting in the 7,000 range, if you will. There's a number of factors, right? Weekends, we'll see a dip and folks coming in. And we've now been testing for long enough in the various sites that, and there's another chart, not the positive one prior to this, if we could show that. And knowing the different sites, thank you. Knowing the different sites, we know what the need is. So for the county testing sites. For the state testing sites, they have a certain capacity that they provide. And so they try to max out those sites. And then there's other factors that play to where you might see peaks and valleys. When we have our hospitals, for example, that are doing elective procedures, depending on which hospitals or what timing they'll do procedures, increased number of testing. We saw, for instance, we opened up our first site at Mira Vista High School in Imperial Beach on Monday. And because of the naval ship and air quality, a little bit more difficult, right? So we saw lower numbers. There's a lot of environmental and other factors that go in play for this, but we're seeing this steady state. I will point out, because of our drop-in site at the County Tubman Chavez Community Center on Euclid, we honor all those appointments. This is a drop-in, so the people that there's no appointments, but we'll honor all those tests. And so you have to get there by 40, and then how many we do. And so we'll see sometimes on 550, sometimes 500. So it's, again, a number of factors that we're seeing. We track the data very carefully to tell us how many tests and where, and that's what guides our decision on our testing sites.
Director Michion, there's another question about testing from Mimi Alcala with 10 News. With the current testing supply shortage nationwide and locally, could this mean potential reopenings would be delayed even longer?
So I think this was an earlier kind of related question, and that is for us testing from when we embarked on testing to it is today, we're testing for the people who need the test. And so that priority group is what we're going after. Our mission is to hunt the virus, to get to those people that need to be tested. So if they're determined to be positive with the work of their physician, again, tied to a medical home, but also the great work of our epi team, is to make sure that they can self-isolate so they're not spreading the virus. And so that level of our T3 strategy, that is what we're continuing to do. That has really no relation to the reopening. I think it gets back to what Dr. Eastman has said, and everything you've been hearing, and that our best approach is really the facial coverings, the physical distancing, the good hygiene that is far better than any test in ensuring that we can reduce the number and the community spread of the virus. Thank you.
We have one final question that was texted in, and this deals with the governor's order. If you want to go ahead and ask it.
And this one is from Mike McKinnon with KUSI. Are you able to overrule the governor's order and allow local businesses who have complied with this order to reopen under the county public health order?
Yeah, and I'll respond to that. The governor's order is the governor's order. We do not have the ability to be less restrictive than the governor. We certainly could be more restrictive, but I think at this point, given our numbers, we're working very closely with our public health professionals, Dr. and her team, and we will certainly comply with the governor's orders. And if saw a need to become more restrictive, we would. But at this point, I think we're confident with what the governor has laid out, and we will work to his order. So that completes our comments for today. Before, I guess this is, another bad news situation because today is tax day, and if you haven't paid your appropriate income taxes or the estimated taxes due in April or June, today is the day you're supposed to do that. I know we got enough things to worry about. I just thought I would get that out there. But I do have some good news. You may recall that in May, we worked with the state to launch the Great Plates program. This program offers meals a day to qualified seniors who are more vulnerable and must avoid leaving home. These meals are
All right, everybody, pretty lengthy update there in San Diego County, California. Pilar Arias still here with you for a little bit longer before Christy Larson wraps up the stream for the evening. I hope you all are having a great hump day. It is Wednesday, July 15th. Hard to believe this month is going by so quickly. I'm going to stay with our neighbors to the west of us, California, Southern California in particular, and take you out to today's 19 update from Los Angeles County, California. Don't forget, if any update here happens live, we will bring it on News Now, both on YouTube and on coronavirusnow.com.
Everyone joining by phone is in a listen-only or muted mode. Later, we will conduct a question-and-answer session. Instructions will be given at that time. If you need operator assistance at any time, you may press star and then 0. I'll now turn the meeting over to Supervisor Hilda Solis. Please go ahead.
Good afternoon. Thank you for joining us for today's press briefing. I'm Hilda Solis, Chair Pro Tem of the Los Angeles County Board of Supervisors. I'm joined today by Dr. Barbara Ferrer, Director of the Department of Health, as well as Dr. Christina Galli, Director of the Department of Health Services. Dr. Galli will share what we're doing to increase much-needed access to testing. We're expanding the testing capacity at several testing sites in areas of great need, including at Los Angeles Community College, in El Monte, and Pomona Fairplex. We're also opening testing sites, including in the cities of Azusa, Montebello, Southgate, in the coming weeks. And I want to thank our cities for their partnership. Dr. Galli will go over in greater detail this plan, which will help us bend the curve of COVID-19 again. This crisis intensified. It is getting worse, and it is affecting people of all ages. To underscore the gravity of the situation, I'd like to share the story of a young COVID-19 survivor who I spoke with last week. She is 33 years old and considers herself an athlete. She's a runner for more than 15 years. In fact, she went on a miles run on the day she started to experience COVID-19 symptoms. 111 days later, she is ring but is still symptomatic. She shared with me that her acute phase of illness lasted over 2 weeks. Her symptoms included severe levels of blood clots, seizures, heart palpitation, shortness of breath, and a terrifying range of other symptoms. Now she is on week 16 of her symptoms. She has not had a symptom-free day in over 3.5 months. Again, she is 33 years old. Still, COVID-19 has upended her life. She told me that she misses her friends, her family, and has been unable to live her full life in months. I tell this story to underscore once again that being a young person does not shield the seriousness of COVID-19. In fact, a new study by researchers at UC San Francisco found that 1 in 3 young adults may face severe COVID-19 cases, with smoking playing a big part of the risk. People ages 18 to 40 made up 10% of the county's hospitalizations in April. Now they make up 25% of those hospitalized due to COVID-19. Currently, 44% of people with the virus are ages 18 to 40 in LA County. And that is why I implore you to turn down that invitation to hang out with a group of friends. Resist the urge to join a family gathering and encourage them to connect virtually. In-person gatherings, which remain prohibited, are simply not worth the risk. And please wear your mask. It is required. And as our Native American Indian Commission shared earlier this week, wearing a mask is an act of love. In fact, studies have shown that masks do a lot more to protect you and others around you than you had previously thought. One of the most important questions right now is whether to reopen our schools. I can't imagine what students and families are going through right now with all of this uncertainty. Likewise, the teachers and staff who would have to take on this monumental task. It is a tough decision to make, but the safety of our children and school employees must come. If a school district decides and is allowed to resume in-person instruction, then it needs to be cautious and flexible while complying with all the guidelines put forth by the Department of Public Health. This virus is unpredictable. So unfortunately, we need to adapt and do so. If a district is not able to comply with the safety protocols, and if there is too much community transmission, then it should continue with distance learning. This is going to place a huge responsibility on parents and will result in learning loss. It's a sobering reality, but it tells once again that in order for our schools and economy to reopen, we must slow the spread of COVID-19. Simply put, we must again focus on flattening the curve for our children, for our families, and for the health of everyone. I also want to address the COVID-19 outbreak at LA Carroll. Over 300 garment workers have tested positive, and tragically 4 have died. I recognize this is an unprecedented time for all of us, but the health and safety of employees can't be compromised. That means that safety protocols must be followed. Please visit health.la.gov for more information about these necessary protocols. Businesses are required to follow. And I also want to encourage employees to call 888-700-9995 to report unsafe work conditions. Reports may be anonymous, and there will be no questions about personal information, including immigration status. We share collective responsibility to get through this moment. Thank you all for doing your part. And now I would like to introduce Dr. Barbara Ferrer.
Thank you so much, Supervisor Solis. You've been a steadfast voice for our most vulnerable residents, including those with a higher risk for serious illness from COVID-19, and I'm extraordinarily grateful for that. And good afternoon, everyone. First, I do want to acknowledge this has been a tough week for our community as we continue to move through these unprecedented times. The difficult decisions that are being made at all levels of government are made to protect the health and safety of everyone who lives in LA County. To put that in perspective, we reported troubling and startling data. We saw the most cases we've ever reported in a single day, and we also unfortunately had to share that 73 people had died as a result of COVID. To put that in perspective, the most deaths we ever reported in a single day is 76, and that was back in May, when we unfortunately had so many residents in our nursing homes that were passing away. We're also seeing the most hospitalizations since this pandemic began. Today's data is just as distressing, and I will update you on this information. After that, I'll have an opportunity to share some new data we have on who's being hospitalized and the trends that we're seeing in hospital utilization. We are in an alarming and dangerous phase in this pandemic here in LA County, and we're in this place along with 29 other counties across the state. These alarming trends reflect behavior 3 weeks ago, and it will take several weeks to see if our behavior now, including the rollback of previously opened sectors, slows the spread of the virus. What we do impacts our lives in the weeks and the months ahead. We're just not able to continue on our recovery journey without everyone doing their part. Keeping businesses open is only possible if we can get back to slowing the spread. And we do need to remember that all of us play a part in protecting the capacity of our healthcare system so that we're all able to access critical care when we need it. Our efforts also need to focus on the disheartening and devastating reality that here in LA County, our Black and brown residents and those with limited income are disproportionately affected by this virus. And you'll hear more about that today from both me and my Department of Health Services colleague, Dr. Gabby. I do want to start with reporting our daily numbers on deaths and case counts, and then I'll offer some broader context on this data, including a focus on equity. I am sad to report an additional 44 deaths today. 27 of the people who passed away are over the age of 25, and 25 of the people over the age of 5 who died had underlying health conditions. 13 people who died are between the ages of 41 and 65, and 8 people in this age category had underlying health conditions. Information on the 2 deaths that are and 1 person passed away between of 18 and 40, and this person did have underlying health conditions. I do want that every day for the last 2 weeks, I've reported on deaths that have occurred to people in the younger age group. And I hope folks are taking note. I really appreciated what Supervisor Solis was saying about the fact that, unfortunately, this virus wreaks devastation in every single age group of people who live here in our county. Information on the 2 deaths reported by the City of Long Beach and the 1 death reported by the City of Pasadena are available at longbeach.net and cityofpasadena.gov. This does bring the total number of deaths to 3,932 in Los Angeles County, and 93% of the people who have passed away had underlying health conditions. For the 3,598 people who passed away where ethnicity has been identified, 45% are Latinx, Latino, 26% are white, 16% are Asian, 11% are Black, and less than 1% are Native Hawaiian or Pacific Islander, and 2% identified with another race ethnicity. I'm also reporting 2,758 new cases today, and this does bring the total number of cases in LA County to 143,009 cases. These cases do include 5,849 cases reported by our partners in the City of Long Beach and 1,580 cases reported by the City of Pasadena. We're also confirming 833 cases among people experiencing homelessness, and among these cases, 303 referred to isolation and quarantine sites where they could appropriately isolate for the duration of their illness. We've investigated now a total of 978 residential settings and non-residential settings with at least 1 confirmed case of COVID-19. And of these, we currently are investigating at 718 sites, closed investigations at 260 sites where they have had no new cases for at least 2 weeks. Residential settings, as a reminder, include nursing homes, assisted living facilities, shelters, treatment centers, supportive living, and correctional facilities. Non-residential settings include workplaces, food and retail, and educational settings. And as I showed you on Monday, it's in the non-residential sites where we're seeing the steepest increase. The total number of confirmed cases in institutional settings is now 22,731. And this includes 13,207 cases among residents and 9,524 cases among staff. I will be able to update the data on the deaths of residents in institutional settings later today, and you'll get that information on our website. We're also reporting 3,284 confirmed cases at some point in time in the jail facilities. This is 2,951 among people who are incarcerated and 333 among staff. The Sheriff's Office is reporting for their facilities today 47 inmates that are positive, 804 people that are incarcerated that recovered, 76 inmates that are in isolation, and 2,545 people who are incarcerated that are quarantined. There are 188 cases in the state prison, 131 are among people who are incarcerated, and 57 among staff. And there are 750 cases in the federal prison facilities. This includes 741 among people who are incarcerated and 16 among staff. And there are now 90 cases in our juvenile facilities, again, a slight increase from earlier this week. 35 are among youth and 55 are among staff. 1,409,712 people have been tested and had their results reported in LA County. 9% were positive over time. The 7-day rolling average daily positivity rate is now at 9.8%. And can you please put up the first slide? First, I wanted to be able to update you on some data we have on hospitalizations, which, as you know, are increasing, and we're now seeing the highest rates we've ever had since the onset of the pandemic. We have known that since Memorial Day weekend, younger people have been infected at higher rates than before. And if you take a look at the blue line, it now shows us that younger people between the ages of 18 and 40 are also being hospitalized at a significantly higher rate than we've seen before. And it continues to increase, almost at 30% now. The next slide, please. This slide shows us the percent change by week on daily hospitalizations, on weekly hospitalizations. You can see that in the last few weeks, hospitalizations have increased significantly, and we are on an upward trajectory. The shift from declining rates to increasing rates happened very rapidly. And we now see a 3-day average of over 2,000 people hospitalized on a given day, which is more people hospitalized each day for COVID-19 than at any other point during the pandemic. This slide mirrors what we're seeing and reporting on in terms of our daily hospitalization rate. Those who are being hospitalized and need intensive care, that's also at a higher rate than we've seen before. And I'll take the next slide. And this is troubling because, as you know, care in the ICU is limited. Unfortunately, this is also further evidence that we should probably expect to see an increase in deaths in the coming days and weeks. What this really means for all of us is that we need to start and continue to take the steps that protect our healthcare infrastructure so that hospitals are able to manage the growing number of people that need inpatient care. That's why it's so important to follow the public health directives, like staying home, avoiding close contact with people who you don't live with, and wearing your face covering at all times when you're out of your house. As you know, we also watch a set of daily metrics very carefully so that we can actually make some assessment about how well we're doing on our recovery journey. And today I want to actually share again our 7-day trends and provide a little bit of an update on some of the indicators that we're tracking and again some of the changes that we're seeing over time. So I'll take the next slide. As you know, we watch the daily, as you know, this graph, which I've shown before, has a 7-day average of the daily reported new cases of COVID-19. And you can see easily how much of an increase we've had this last month. At the beginning of June, the 7-day average of new cases was 1,452. And now we are averaging 2,859 new cases a day. This is double where we were at the beginning of June, and it's higher than it has been at any point in the pandemic. The 7-day average paints a clear picture of what's happening these last few weeks, which really is that we continue to see a sharp increase in what we call community transmission. Our rate of having each of us who's infected infect other people, and the number of people that are infected that are unfortunately out and about in the community capable of infecting others. We'll take the next slide. This slide shows the 7-day average of the daily percent of positive tests over time, which is also now increasing steadily from a low we had back in May. At the beginning of the pandemic, we were mostly testing people who were sick, and our positivity rate was about 15% in early April. Now, even though we're testing way more asymptomatic people, our positivity rate is just about 10%. Again, a concerning trend. The next slide, please. This shows this past 7-day average of daily deaths. And you'll note that it does look like for a while our deaths were on a downward trajectory. And I want to thank everybody who worked so hard to make this possible. But two things to note. One is it's no longer on a downward trajectory. And two, it's what we call a lagging indicator. And that we're worried that in a few days from now and a week or two from now, we will actually see our deaths increase because they're associated with the increases that we're seeing in hospitalizations. And yesterday, I reported 73 deaths, which is one of the highest daily death totals for the pandemic. And today we reported, sadly, another 44 people have passed away. And I just want us to all note and take a moment to silently reflect on the past, all of the people who passed away were parents, grandparents, siblings, friends, and neighbors, and they've left a huge hold in the lives of their loved ones. And our prayers are with all of them today as they're grieving. I do want to spend a few minutes also discussing issues related to equity and the pandemic. The reality of this pandemic is that people of color and people in high poverty areas are bearing the brunt of this virus. Systematic racism and discrimination remain root causes and the main drivers of the inequities that we see that result in serious illness and death. And unfortunately, a lot of the disproportionality can be traced to the fact that a significant number of essential workers are low income and/or are people of color. They couldn't stay home at work, and early in the pandemic, there were few protections that were offered at many work sites. There were no requirements for anybody to wear a mask or a face covering, and there were no requirements for physical distancing. And also in many places where people went to work who were essential workers, infection control was just not a priority. So we need to focus significantly in order to address the alarming trends. And the first thing we need to do is to ensure that all workplaces offer essential protections to every single worker. And the second thing we need to do is to deploy resources to the hardest hit communities. And some examples of how trying to do this include when the research and the data showed that masking and physical distance was key to slowing the spread, public health immediately issued protocols that required businesses to meet stringent requirements so that they could care for the safety and the well-being of their employees and their customers. We were among the first jurisdictions, if not the first, to do so. Our protocols for sectors that are open are also written as legal requirements and not as recommendations. We set up a complaint line where violations can be reported. We've deployed dozens of health inspectors to follow up on violations. However, this work is best done in partnership with the businesses so that they can make sure that all workers are protected. We all share a common goal: slow the spread by preventing employees, customers, and visitors at any facility in the county from transmitting the virus or becoming infected. Business owners and operators have a corporate, moral, and social responsibility to their employees and to their employees' families to provide a safe environment that adheres to every single one of the health officer directives. This responsibility is more important than ever as we continue to fight this deadly virus. And now I want to also look at some of the data around what we know by race and ethnicity and poverty levels. So I'll take the next slide. First, let's look at the case rates by race and ethnicity. As you can see by the yellow line on this slide, Latinos, Latinx community is more than twice as likely as white people to be infected with the virus. Latino people and Latinx people are also twice as likely to die of the virus, and we'll show that in a minute, when compared to white people. And to white people, black people are 25% more likely to be infected with the virus and almost twice as likely to die from it. That's the green line. That's on the next slide, please. Next, I want to look at differences by community poverty rates. And on this slide, the yellow line shows the case rates for communities with the highest rates of poverty. And you'll see that these communities continue to experience almost times more cases than communities at the bottom, which is the blue line, that have little or no poverty. And people in communities with high levels of poverty are 4 times more likely to have COVID-19 than are people in communities with low levels of poverty. As with their disproportionately impacted groups, the high rates of cases and deaths reflect a number of, including the effects of systemic racism and discrimination in our country and a lack of the resources and opportunities that people all need for good health. This includes living in more crowded housing conditions that make it physically hard to distance, having employment in work settings that have insufficient protections, and having more serious risk factors with related illness, such as heart disease, respiratory disease, and diabetes. And most importantly, continuing to have less access to the health care and the support services that really help all of us remain healthy or return to health after we're ill. We'll take the next slide. This slide just really highlights again the mortality rate differences that are experienced by race and ethnicity and by areas here in LA County. And as I noted before, Black and Latino residents in the county are twice as likely as white residents to die of COVID-19, and those that live in communities with high rates of poverty also experience a disproportionate burden, and they're 4 times more likely to die of COVID-19 when compared to residents that live in communities with the highest incomes. The data that I'm reporting to you today is disheartening and distressing, and it shows that we're not yet doing enough to address these inequities in our community. I'll take the next slide. Some of our efforts, such as improving access to testing, have been successful, as seen on this slide, which shows us that people in the neighborhoods with the least income, which is the orange bar on the right, are more likely now to have been tested. From the very beginning of the pandemic, it's been a top priority for LA County to ensure that residents have access to testing regardless of their income. And this is especially important since communities with the highest poverty rates have been especially hit hard by this virus. However, a lot of work remains to be done. Additional strategies and investments are needed to ensure that those communities experiencing the highest rates of COVID-19 have resources that allow residents to be connected early to care and to social services. Additional support for low-wage workers so that they're able to both easily report violations and also connect to resources for elevating critical concerns. And we need to be mindful that trusted organizations in communities where they're experiencing elevated risk need to be supported so that they can communicate and disseminate accurate information about the virus and strategies for protecting oneself and one's family. So although we're now in this very troubling phase of the pandemic, I know that with a lot of hard work and our collective efforts, we're going to get to forward, and we're going to get back to flattening the curve. We did it before, do it again. And it only is going to happen if we're all working together. So as a reminder, please stay home as much as you can. If you do need to go out for work or important errands, always wear your face covering and wear it correctly. It needs to cover both your mouth and your nose. If you don't wear a face covering correctly, it protects no one. And remember, even though we all miss summer barbecues, pool parties, and other fun and normal things we would be doing on a hot summer's day in July, it still isn't safe or smart to return to seeing friends and family that you don't live with. You could be infected without knowing, and you could pass along the virus that could be fatal to someone you love or someone I love. And while these are disappointing realities, it should be of some kind of comfort to that our behavior and the simple actions of kindness and sacrifice end up protecting those we love and those who are most vulnerable in our communities. And ultimately, it's these acts of kindness that get us back to the road of recovery. And now I'm going to turn it over to my colleague, Christina Galli, the Director of the Department of Health Services.
Hi, good afternoon. I'm Dr. Christina Galli, the Director of the Department of Health Services. As Supervisor Solis mentioned at the beginning of today's briefing, I will focus on what we're seeing from an equity and access perspective with respect to testing across the county. DHS is working swiftly to mitigate the impacts and provide support for the communities that are most in need of help. Before I get started, I want to take a moment to say I know that this is all a difficult time for everyone. The fight against COVID-19 feels like a lot to handle. I continue to urge each and every one of you to do what you can to protect your mental health and those around. Go for a walk, interact with your friends in a safe way, socially distanced, and reach out to your doctor and to a mental health helpline if you need assistance. Unfortunately, while we're all impacted in innumerable ways by COVID-19, the impact on some communities and groups of individuals is more serious than that for others. We know, and as Dr. Ferrer just walked through in detail, certain communities, particularly low-income communities and Black and Brown communities, are disproportionately impacted by COVID-19. And that understanding is and has been guiding DHS's response with respect to testing to this point. DHS has taken a geographically focused approach in supporting testing locations across the county in a way that ensures equitable distribution of resources and in a manner that is sustainable across the county's diverse communities. As we work to integrate testing into the established healthcare system, we're also working with providers who are resources within these communities, who are known and trusted and respected by the residents who live there. People in these at-risk communities can come to any county testing site, city testing site, or can go to any one of a number of these trusted provider partners, including clinics operated by the Department of Health Services, as well as other community clinics and federally qualified health centers. We are also working with clinics to support their ability to be able to provide testing service to their patients. This includes communication support, technical assistance on reimbursement and billing, connections with labs if people don't have familiarity, and assistance with access to PPE and other resources as needed. Even though we have been focused on the issue of equity and access today, there's a lot more work that needs to be done. The data that DPH has shared on the disproportionate mortality that the Latinx and Black communities experience in particular make this crystal clear. While testing is not the only component of the response to address these racial and ethnic disparities, it is one important piece. Given that, I'll begin by providing an update about how the COVID-19 trends are impacting certain communities more than others, so we can talk about what DHS is doing from a testing perspective. The next two slides, if you'll turn on the slides, the next two slides tests that are positive by race and economic status. And Dr. Ferrer just went through a version of these, but I want to walk you through them as well. Test positivity is an important indicator of both the trajectory of the pandemic as well as our ability to provide sufficient testing to keep transmission low. This first slide is on test positivity by race. The rate of positive tests is much higher among the Latinx community than it is among any other racial or ethnic group, a trend that has held constant for months. Further, white individuals have consistently the lowest rate of test positivity. This can reflect the greater relative access to and use of testing resources by white populations, and also their reduced risk of being exposed to COVID-19, a fact that Dr. Ferrer also just walked through with some pretty stark data. This is due to the fact of many factors: multi-generational housing, their use, their employment in essential functions that are not easily able to enjoy the privileges of work, among multiple other factors. Sadly, the underlying reasons why communities of color are disproportionately impacted by the worst outcomes of COVID-19 is related to long-standing structural and systemic issues, including social determinants of health, that the county is working to address and mitigate in the midst of this pandemic. Even though testing utilization is relatively higher among certain communities of color, more clearly needs to be done. On the next slide, we will also look at positivity rate by area of poverty. These findings are also very concerning. It shows a direct correlation between poverty level and test positivity. The lower one's income, the higher the rate at which they are testing positive for COVID-19. Poorer areas and the poorest areas are the most impacted, as shown by the red line, and those areas with the least incidence of poverty are shown in the light blue line and are impacted the least. This reflects again the burden that our low-income communities face in terms of their exposure to the virus, and also that they were not and still are not accessing testing at an appropriate level given their degree of burden. We also need to recognize, though, that adding testing is needed. The demand has outstripped the supply among those who want to have tests, and more needs to be done. That's why, though, because of these charts that we've just gone through, we have an obligation to add the capacity in a manner that addresses the stark disproportionality of necessary tests that is facing certain vulnerable populations. With this in mind, we undertook a data-driven approach to understand how we can push for equity and access to testing for those who need it most. To the next slide, you'll see a heat map. All of this is on the DHS and the county COVID website. A heat map that identifies the hotspot communities where the compilation of available metrics indicates that these communities have the greatest need for increased testing access. These hotspots are defined by 3 different metrics. First, test positivity rate, which we've just walked through, and there's a disproportionate burden borne by low-income communities and persons of color. Second, the fatality rate, which we also know disproportionately affects individuals who are low income and persons of color. And please note that we have removed the deaths in skilled nursing facilities and taken into account these numbers to focus just on the community-related deaths. And also the testing rate, or the rate at which accessing testing services broadly, regardless of where that test took place. This looks at communities that are not meeting the state threshold of 1.5 tests per 1,000 population. The communities that you'll see in red are those that have the greatest need. They do not have sufficient access to testing and have been disproportionately affected by COVID-19. So with that in mind, we are expanding the county's testing sites by 65% over the next couple of weeks, with the entirety of that expansion focused on areas of high need per the heat map that we've just walked through. This includes new testing locations that will be set up in Montebello, Southgate, Azusa, Panorama City, Compton, Downey, Norwalk. Of these 6 areas, we've secured contracts at the majority and plan for a launch on a rolling basis over the next 2 weeks. We are also adding access at existing testing locations in other high-need areas that were highlighted on that map. The 4 priority communities that we'll be adding access to first are Bellflower, Pomona, El Monte, and LA. We appreciate the immense partnership with the various cities and local leaders that have really come to the table and helped us to quickly establish and expand sites so that we can swiftly address the disparities that we all see. The above capacity is in addition to new testing sites that have been brought online by community clinics, by the Department of Health Services clinics, and by other partners, including pharmacies. I'll remind you that per the recent health officer order issued by DPH last week, and consistent with the sentiments that were relayed yesterday state in the launch of their renewed coronavirus testing task force, that providers are required to provide testing for their patients and plans are required to pay for it. This is a step in the right direction, but more needs to be done. Our efforts to address racial and economic injustices of COVID, we aren't only focused on testing capacity. There are several other areas of focus, which I will highlight just very briefly before I turn it over to Dr. Erica Flores Uribe, one of the individuals who is helping to lead our COVID equity work within the Department of Services. First, a site is not helpful, obviously, if people can't access it. We know there's a digital divide in the county. Please know that many of our sites have an option to sign up by phone. Internet access is not required, and we will continue to work to make sure that the options to sign up for testing by phone are expanded. There's also a misconception that individuals must have a car or be able to drive through in order to obtain testing. This is absolutely not true. 38 testing sites currently within the county are walk-through testing sites, not drive-through testing sites. The map on the COVID-19 county website distinguishes between drive-through and walk-through testing sites so that people can select the model that best suits their needs. We will also continue to prioritize addition of both walk-through and drive-through as the pandemic continues. And finally, looking toward a solution long-term for how we can protect people with COVID, DHS is actively looking for ways to ensure that all communities we serve are appropriately and fairly included as full partners in research efforts to develop new treatments and vaccines that it will allow all of us to put the pandemic behind us for good. Testing sites can be one of many important access points of entry for such studies. In order to build on the efforts to support underserved communities by expanding testing, DHS has allocated $4 million from a grant from the Centers for Disease Control to support outreach to most impacted communities. This funding will support a wide variety of communication efforts from broadcast media to grassroots in-language, culturally responsive messaging campaigns. It will also support work with community-based organizations to perform outreach, provide information, education to community members, engage them and link them to COVID-19 testing, healthcare, and other supports like housing access, food access, and health insurance. Understanding the historic limitations to access and the potential mistrust of the healthcare system that many of our highly impacted communities experience, DHS is investing in these communities and in the community-based organizations that are trusted in collaboration with the Department of Public Health. By collaborating and funding partners who are embedded already in these communities as trusted messengers, more effectively reach our most at-risk and under-resourced communities. I'd now like to Dr. Erica Flores-Uribe, the Director of Language Access and Inclusion with the Department of Health Services, who, with Dr. Clemens Hong, is co-leading our outreach and community engagement. She'll share an update just briefly on some of the successful models that we've piloted to date and how we might in the future. After that, I'll return briefly to discuss criteria for testing and the hospital demand trends.
Thank you for that introduction, Dr. Galley. As Dr. Galley discussed, this work is not just about adding more testing sites in areas that are highly impacted. It doesn't stop there. It's about funneling resources to communities that have been historically under-resourced, especially as we see the rise of COVID-19 in communities of color. Both Dr. Ferrer and Dr. Galley highlighted this rise, particularly in the Latinx community. These make resources such as in-language and culturally responsive support services even more critical. The county and the Department of Health Services is responding. DHS, in collaboration with other county partners like the Department of Public Health and community organizations, are meeting under the Advancement Project to develop recommendations on how to best coordinate community-based organization engagement, education, outreach campaigns, and system navigation. Today, I will provide a brief overview of how DHS leverages public-private partnerships to support our communities and how identifying geographic areas of need through the hotspot maps discussed by Dr. Galley allows DHS to continue to commit, prioritize, invest, and expand these efforts to reach our most vulnerable populations. One example of a successful public-private partnership is our testing site on the campus of Charles Drew University. This operates in partnership between our MLK Outpatient Center and Charles Drew University. This site in a high-risk, vulnerable area in South LA has proven successful in reaching those that that we saw in the positivity charts earlier disproportionately impacted and live in areas that the map indicated have limited access to testing. A recent report from this site highlights the following best practices. By partnering with trusted community partners for grassroots communications like flyer distribution, local venues like grocery stores and faith-based organizations, as well as in-language and culturally responsive messaging via several media outlets, high-risk communities were most effectively reached. In fact, these outreach efforts effectively reached a population of 86% self-identified communities of colors. This is completing over 1,000 tests on average per day at this site. The data from this report shows that 70.7% of those tested identified as Latinx. They made up 88.8% of those who tested positive. This is one of the highest positive infection rates of one race and ethnicity group. Once engaged through the testing site, the MLK CDU staff screens community members for housing, mental health, and other social services needs, in addition to connecting them to medical care. In fact, these efforts identified that over 30% of those tested did not have a primary home. In high-risk and high-impact communities like this, MLK CDU model was a successful example of how a DHS-19 testing site can function to link the community to medical care and support services during this difficult and economically uncertain time. We are looking to support other sites in high-risk areas to follow a similar model like this one, utilizing hotspot mapping to identify the hardest hit communities allows for not only mobilization of testing resources, but also mobilization of support services and protective supply to highly impacted communities. For example, given the rise in COVID-19 numbers that we saw in communities South and East LA, we effectively partnered with the United Healthcare Group to distribute over 10,000 resource kits. This distribution happened out of our MLK CDU site, and it was a donation valued at over $400,000. This distribution has been happening over the last couple of weeks, and it's providing our community with essential needs like face coverings, food vouchers, and hand sanitizers. This is also an opportunity for us to share with community educational material that's in language and culturally responsive. This material provides information on when and how to seek care, as well as how to seek other protective services and stay safe during this time. One of the community members shared that there is a need for PPE in the community. People have to decide between food versus buying masks. It's going to be food. I'm glad that there is PPE where it's needed. Across the county, we're utilizing a similar approach to distribute protective resources and educational material directly to trusted community members and businesses in high-need areas. Countywide, in June, DPH and DHS partnered with the Advancement Project to distribute protective equipment to our most impacted communities. This distribution is almost 1 million face coverings, several thousands of hand sanitizers and face shields, and educational material that reached over 120 community-based organizations. These organizations share that many establishments will not allow people to use their services unless they have a mask. Many community members are left without services due to inadequate access to masks or having old, worn-out masks. By having PPE distributed by DHPH, they are not able to go into businesses like grocery stores, use public restrooms, and attend service-based events. I want to thank our partners in these efforts, and I want to share that we are committed to continuing this work to support communities that are most impacted by COVID-19. I'd like to hand it back to Dr. Galley now.
Thanks, Dr. Uribe. I'll shift now to provide an update on who is prioritized for testing in the county and then briefly touch on the hospital bed demand model. There are many media reports that as a result of increased demand for testing over the last week or two, that the county changed its testing criteria. These are absolutely wrong. The Department of Public Health announced its revised testing criteria, which is posted on their website 6 weeks ago on June 2nd. That criteria highlights the following populations being recommended for testing: those who have no symptoms, those who have symptoms, those who have a known exposure to someone who is positive for COVID-19, and those who live or work in a high-risk setting, such as a skilled nursing facility or a homeless shelter. Implementing this guidance was an involved process at our testing sites. This criteria will become effective at LA County and LA partner sites today. In addition to the populations I just mentioned, essential workers will also still be prioritized for testing in line with the new criteria that was released by California Department of Public Health yesterday, though the state makes it clear that the higher priority should be given to populations that are listed in the LADPH guidance. So if you are unsure of whether or not you need a test, first check with your healthcare provider. Unless you have specific symptoms, live or work in a high-risk setting, are an essential worker, or a known close contact of someone with COVID-19, you may not need to be tested, and your healthcare provider can talk to you about your concerns, your risk exposure, and your specific situations. If you don't have a doctor, you can call the county's 211 line to get a referral. As I mentioned previously, healthcare providers are now required by LA County Health Officer Order to provide their patients with access to COVID testing, just as they do for any other condition. The health officer order also encourages providers to bill private insurance plans for these services when necessary. Patients are not allowed to be charged by their plan or their provider for COVID-19 tests. As mentioned on the state call yesterday also, the State Department of Managed Healthcare will also be coming out with additional guidance on this subject in the next couple of days. Obtaining a test through your provider or the provider network helps to assure tailored clinical advice that takes into account your specific history and facilitates good follow-up in case of a positive test result. I'll turn now briefly to touch on the hospital bed demand model. This week's data demonstrates an increased number of new daily hospitalizations that is driving an increase in the overall number of patients hospitalized in the county, a fact that Dr. Ferrer walked you through on the slides previously. There has also been an increase in patients that are requiring ICU care and ventilators, and sadly, an increase in the daily reported mortality. All of this suggests that transmission is increasing in the community. The model currently estimates the effective transmission number at 1.07. If this continues, while we do have a sufficient number of beds and ventilators, the number of ICU beds, as I've shared before, is more limited and may become adequate. The EMS agency, working in partnership with the Department of Public Health and with the private and public hospital community, is working to implement private hospital and public hospital surgeons and disaster plans to support their staffing needs and to support the ability to move patients fluidly in and out of the hospital as needed. A full set of slides and the model predictions are posted, as always, on the DHS and county website in both English and Spanish. In closing, our focus is on doing everything we can to support the health of the general public, with a specific focus of support and resources on the communities that are most suffering from COVID-19, and also on preserving our hospital system for all of those who might need it, whether they have COVID or don't. We continue to ask that everyone stay home as much as possible and wear your face covering when you are outside. This is not the time to let our guard down. Everyone, as Supervisor Solis walked through with that story today, everyone can be affected by this virus. It isn't the elderly, it isn't just people with underlying health conditions, it isn't just people in skilled nursing facilities or homeless shelters, it isn't just people who live in any particular zip code. We all do the basic things: wear a mask, stay at home, isolate when sick, quarantine for the full 14 days regardless of the test result. All of these simple basic steps will help us to stop and slow the virus transmission and get it back under control. It will protect your life and that of those of. With that, we'll turn it over to questions.
And ladies and gentlemen, if you wish to ask a question, please press 1 then 0 on your telephone keypad. You may withdraw your question at any time by repeating the 1-0 command. If you are using a speakerphone, please pick up the handset before pressing the numbers. Once again, for questions, you may press 1 then 0 at this time. We'll go to Claudia Pashuta with KNX News Radio. Your line is open.
Thank you. What is the range on the transmission rate? Because it's so close to 1. I'm wondering, is it definitely above 1? The number of LA County residents believed to be infected and who may be unknowingly infecting others. And then also, if you could explain, given that hospitals and daily case counts are higher than they've ever been in LA County, why are we not seeing the kinds of taken earlier in the pandemic, such as the opening of the Surge Hospital or getting a naval hospital ship to Via? Thank you.
Thank you, Claudia. We'll have Dr. Ferrer answer them.
Thanks. Oh, sorry. Thanks so much, Claudia. Yeah, I think a couple of things are important to note. Early on in the pandemic, we didn't really have a lot of information about what we anticipated could be a pretty steep increase in hospitalizations, and everybody at the very beginning was really doing all they could to make sure that we had enough hospital beds. I think we've learned over time how we need to prepare for increases in caring for people who need hospital care. And at this point, there really is no need to open the additional facilities. You know, just to note that the biggest issues that we have in all of our healthcare settings is making sure we have enough workers to staff all of the beds that are available. So I think Dr. Galley can talk more, but you know, this is a system-wide approach, and I think some of the things we did at the very beginning we actually don't need to do now, because we've learned a lot about how to manage caring for people who are sick with COVID-19 in our hospitals. We've also learned about how to predict what we think might be the need for additional beds in the future. All of the modeling, it's all of the good data points that we have now, and most of all, it's a lot of experience from the past 5 months of managing this. And I think the same is true of, you know, what's going on with sort of the increase in cases, and how are we really preparing ourselves for what could be continued increase in cases. Obviously, the first job that, you know, public health is working the hardest on is preventing additional unnecessary transmissions. You know, this is a virus where the best we're going to be able to do is slow spread. We're not going to be able to actually stop the spread right now, but slowing the spread is critically important. Again, we know that there are a lot of action steps that we can take. I think most important has been noting that this virus is more easily transmitted and is more capable of infecting people when they're inside. So you see a big push to try to get as many acts as we can outside, and then if they are outside, to continue to do all of the infection control and all of the distancing. You know, our hope is that the behavior we're seeing, you know, and have seen this last week as we started closing down some of the opportunities for increased transmission in indoor settings, will lead us to get back to slowing the spread. I don't think there's a magic number here that we're aiming for. Clearly, we don't want to continue to see upwards of 3,000 or more cases, new cases a day, in order for us to claim that we're successfully managing to continue slowing the spread. But I'm going to turn it over to Dr. Galley about the modeling question. And the hospital.
Hi. First, I want to underscore what Dr. Ferrer just said about the alternative care sites. Alternative care sites are brought online when the biggest problem is the physical bed space, when there's not enough physical space to have patients safely within the existing hospital system. That's not the issue. The issue that is most constraining the supply of available beds is staffing, and alternative care sites do nothing to resolve that problem. So rather, what's needed to focus on those staffing resources. We're appreciative to the state for their assistance and for federal resources as well. But this is something that we continue to work on with both public and private hospitals. In direct answer to your questions, the effective transmission number is 1.07 with a range of 0.94 to 1.2, and the estimated number of individuals who are infected and not isolated, so infectious to others, is estimated at 1 in every 230. We'll turn to the next question.
We're going to Conan Nolan with NBC Los Angeles. The line is open.
Dr. Ferrer, very quickly, some clarity on the contact tracing that you've done thus far. We've been hearing anecdotally that much of the spread, the vector for the spread, has been in office buildings such as Apparel, where they had an outbreak, 300 individuals. And then there's this question of family gathers. But does the contact tracing point to any specific areas that you can give us? And do you have any evidence of people who've contracted this disease outside?
Yeah, these are such good questions. And obviously, I wish I had really definitive answers. We do, the problem with contact tracing is it doesn't necessarily always identify the source of the infection for the case. Many times, because there's a long incubation period and because people are actually infectious a couple of days before they actually develop symptoms, if they're going to get symptoms, and for asymptomatic people, it's really even harder to tease out. It gets so complicated to figure out for everybody what exactly was the source of exposure that led them to become positive. And the most important thing for us to note is that oftentimes people have potential multiple sources of exposure. The times where it's the easiest is when it's really clear that I know I was at a gathering and a person was positive, or I had a work exposure and one of my coworkers was positive, or I, in fact, went out to a setting where I was notified that, in fact, somebody who was in that setting with me was positive. I do want to provide the things I do know I can assure you of is that, yes, there is transmission outside. Clearly, there have been a number of family gatherings and social events that people have held outside, 100% outside, where there's been family members or family members and friends who have all become infected from a common exposure. And in that case, it was easy to sort of trace where, in fact, the source of infection was. So while it's obviously harder to get infected if you are outside, it's pretty easy to get infected if you're outside, you're not doing any social distancing, you're not wearing a face covering, and you're taking no infection control practices to heart. So there's not a lot of washing hands, people are sharing utensils, people are sharing food. Pretty easy to think about how there could be transmission in those settings, whether you're outside or you're inside. So I want to make sure people are clear that outside is in terms of air circulation, but better in this case means you're still doing all of the distancing and infection control that you're being asked to do in order to minimize those exposures, resulting in people actually getting infected. So we'll go on to the next question.
Yes, that is from David Rosenfeld with LA Daily News. The line is open.
Hi, good afternoon. Thank you so much for all the information. It's really quite a lot to digest. I was wondering if you could expand a little bit on where the healthcare workforce is going to come from. We've heard about the state's health corps. I think maybe there might be some Department of Defense piece to it that might be coming in. I wonder if you can provide any more details on that. I also missed the current hospitalization number. I'm wondering if you could repeat that, please. And in terms of testing, could you just clarify the sites that you mentioned? I think there were 4 sites that are online this week, and then the others were planned for coming weeks. Is that correct? That's all. Thank you.
Yeah, we'll have Dr. Galley begin and then Dr. Ferrer.
Hi. So the first question with respect to staffing, so yes, you touched on this, the main state and federal resources, federal side, Department of Defense, Medical Reserve individuals are being deployed to California with 2 teams coming to Los Angeles County. The State Health Corps with a number of individuals that they're working on processes for mobilization. That's in addition to all of the efforts that hospitals do normally and under surge conditions as written into their surge and disaster plans to identify and onboard staffing. That includes looking at recent retirees or individuals that recently left the organization, deploying and reassigning individuals who work in administrative functions but have clinical experience and clinical expertise, people who work in outpatient settings and reassigning them to inpatient work, bringing on additional staffing through contract or registries. There's a number of steps that hospitals will go through to supplement those staffing needs. I'll turn it to Dr. Frere for the second question, but I'll touch briefly on the third. The 6 sites that we will be launching as new sites, and then the 4 that we have plans to add, supplement the test capacity in, those will launch on a rolling basis next 2 weeks.
Today, there are 2,193 people that are hospitalized with COVID-19. Oh, and we'll take the next question.
Thank you. We'll go to Christopher Webb